My name's Dr. Carl Supal, but people call me Dr. Carl. So, especially at our office at the Peninsula Center of Cosmetic Dentistry, the three levels of sedation that we offer from lightest to most sedation would be laughing gas, which is nitrous. Both of the terms mean the same thing, they're used interchangeably. And the laughing gas or the nitrous is the lowest level of sedation. Normally, that's used for kids if they're getting their first filling, and it gives you more of just a floaty effect. Almost you'll feel some tingliness in your extremities. You'll feel just a little bit more relaxed. The middle level of sedation, what we call oral sedation, we use a medication such as Valium or Xanax or Ativan, and we give that by mouth around 30 minutes before your visit. And that is somewhere in the middle because you'll still be mostly awake, mostly alert, but it really helps to just relax you. I would say the middle ground feels almost like a couple glasses of wine, and the IV sedation, or the third level of sedation, the most significant level of sedation that we offer as general dentists here, is the IV sedation, and that is really where you can't fight it. I would say we do have patients that try to fight it, but we always win in a safe manner, of course. And I would say that the IV sedation, the most significant level of sedation we offer, is really good for people who just can't make it through their dental appointment with anything less than that, or for just someone that prefers to get their dentistry done in a single visit and might not want to be awake. In addition, some of our patients want to have IV sedation so that I can provide post-op medications. Whereas if we have the IV in, even if you're able to manage your dentistry with something like oral sedation, the middle level, if we have the IV in, I can administer post-op medications that help with healing. So even if it's a shorter procedure, even if, you're not doing a big full mouth of dentistry, simply using that higher level not only makes you the most comfortable as possible, but it also allows me to maybe give a multivitamin mix through the IV so that you wake up feeling refreshed. Or it allows me to provide an IV NSAID, something like an IV Advil, anti-inflammatory, or an IV corticosteroid to help with healing depending on the scope of what we're doing. You're going to get very sleepy and you're not going to care about what's going on at all. You're not going to care about the noises, and you're going to be so comfortable and so relaxed that you go to sleep. It's almost like if you ran a marathon and you stayed up for 24 hours straight, and then the moment you sit in your bed or you lay down in bed, you go to sleep because you're just so tired and so comfortable. I would say it probably feels similar to that, because as soon as we get the IV in and we provide the medication, within 10 to 20 seconds, no matter what's going on in your life, no matter what's going on around you, you're just going to be totally comfortable and you're going to drift off to sleep. One of the most common questions I get for people that are seeking this type of treatment out, we do what we call titrate to effect. And so when I say we titrate to effect, that means we basically administer small increments of medication through the IV until we notice and we observe the desired effect. And so we don't have a cookie cutter formula and say we provide X amount of medication for everybody and hope for the best. That's a quick way to have something bad happen. And so we only administer small increments until we see that our patient is totally comfortable or snoring in some cases, and then we proceed with the dentistry. And so, we don't actually even think about starting the dentistry until we notice our patients comfortable, ready to start the dentistry. And I would say, since everybody's different and since everybody has, different size, different weight, obviously, but also a different mental block to dentistry, some people have a really bad gag reflex, and no matter what we do, they will require more medication. It's a physiological response to a physical thing in their mouth. Those types of patients, we know going into it that they're going to require more, anesthetic or more medication. We don't just go at it giving them more still. We still go little by little, even though we know, hey, most likely they're going to take more than someone that's just anxious or just afraid of the drill, but we still do it safely little by little until we know they're comfortable. Just like the person that, like I said, is just anxious or might just want it for a longer procedure so they can get everything done. Otherwise they may not even need it. No matter who we're treating, how big, how small, we just do it little by little. little so that they're safe. If you do this all the time like we do, you'll laugh sometimes. Sometimes it's the smallest, most petite people that take the most to get sedated, and sometimes it's the biggest, buff guys that take the least. Sometimes I give a small amount to this big guy and he's out like a light and I need to give no more. And so all of those are lessons as to why it's super important to do it the way we do it. Titrate to effect, give little by little, keeps everybody safe so we can monitor your vitals and only start the work when we notice the desired effect.